What if one of the biggest reasons many men over 50 wake up feeling exhausted has nothing to do with age itself? What if the problem isn't simply getting older, but missing something your body quietly depends on every single day? As men age, many notice changes they never expected. They may wake up feeling tired even after a full night's sleep. Their energy isn't what it used to be, exercise feels harder, recovery takes longer, and intimacy may become more challenging. While these changes are common, they aren't always something you should simply accept without understanding what's happening. One important factor is that healthy blood flow naturally changes over time. Blood vessels can become less flexible, the body's production of nitric oxide, which helps blood vessels relax, may decrease, and maintaining good circulation becomes more difficult. Because healthy blood flow supports the heart, muscles, brain, and sexual function, these changes can affect many parts of everyday life. Another piece of the puzzle is nutrition. Many adults over 50 have low levels of certain vitamins, often without realizing it. In some cases, these deficiencies may contribute to fatigue, reduced muscle function, poor sleep quality, or overall wellness. Scientists have been studying whether correcting these deficiencies may help support healthy aging. In today's video, we'll explore one vitamin that has received significant scientific attention for its potential role in supporting blood vessel health, energy levels, sleep quality, and overall men's health. We'll look at current research actually says, who may benefit the most, the best natural food sources, and common mistakes to avoid. Most importantly, we'll separate evidence-based facts from popular myths so you can make informed decisions about your health. Why men's bodies change after 50? Turning 50 is an important milestone, but it's also a time when many natural changes begin occurring throughout the body. These changes don't happen overnight, and they don't affect every man in the same way. However, understanding them can help explain why energy, sleep, and overall vitality may feel different than they did years earlier. One of the most well-known changes involves hormones. Testosterone levels gradually decline with age for many men. This is a slow process rather than a sudden drop, but even modest decreases can influence muscle strength, recovery after exercise, mood, sexual desire, and energy. It's important to remember that symptoms vary widely, and not every man with lower testosterone will experience noticeable problems. Circulation also changes over time. Healthy arteries are designed to expand and contract easily, allowing blood to reach organs and muscles efficiently. As people age, blood vessels can become stiffer, and the lining of the arteries, called the endothelium, may not function as effectively as it once did. These changes can reduce blood flow throughout the body. One reason for this is a gradual decline in nitric oxide production. Nitric oxide is a natural molecule made by the body that signals blood vessels to relax and widen. This helps maintain healthy circulation and supports cardiovascular health. Lower nitric oxide availability may contribute to reduced blood vessel function, although lifestyle habits such as regular exercise and a balanced diet can help support its production. Sleep also tends to change with age. Many men experience lighter sleep, wake more often during the night, or spend less time in deep sleep. Because deep sleep is important for physical recovery, hormone regulation, and overall well-being, poor sleep can leave someone feeling tired even after spending enough hours in bed. Nutrition is another factor that's easy to overlook. As people get older, dietary habits, reduced sun exposure, certain medications, and changes in how the body absorbs nutrients can increase the risk of vitamin deficiencies. One of the most common is vitamin D deficiency, which is especially common among older adults. Scientists continue to study how low vitamin D levels may be associated with muscle weakness, reduced physical performance, poorer sleep quality, and overall health. However, it's important to understand that taking vitamin D is not a guaranteed solution for these issues unless a deficiency is present. The encouraging news is that many of these age-related changes can be influenced by healthy habits, regular physical activity, quality sleep, a nutrient-rich diet, maintaining a healthy weight, and working with a healthcare professional to identify and treat any deficiencies can all support healthier aging. In the next section, we'll take a closer look at vitamin D, why it has become one of the most researched nutrients for adults over 50, and what scientists currently know about its role in men's health.
The vitamin explained, vitamin D. Now that we've explored why the body changes after 50, let's focus on one nutrient that has become the subject of hundreds of scientific studies, vitamin D. Although it's commonly called a vitamin, vitamin D behaves more like a hormone inside the body. After your skin produces it from sunlight, or you consume it through food or supplements, your body converts it into an active form that helps regulate hundreds of biological processes. Scientists estimate that vitamin D receptors are found in many different tissues, including muscles, bones, immune cells, and blood vessels. One of vitamin D's most well-known roles is supporting bone health, but its responsibilities go far beyond keeping bones strong. It also helps the body absorb calcium efficiently and supports normal muscle function, which becomes increasingly important as we age. Healthy muscles contribute to better balance, mobility, and physical independence. Vitamin D also plays a key role in the immune system. Rather than simply boosting immunity, it helps the immune system function in a balanced way. Researchers continue to study how adequate vitamin D levels support normal immune responses and overall health. Another area receiving growing attention is sleep quality. Several observational studies have found that people with low vitamin D levels are more likely to report poor sleep or shorter sleep duration. While these studies show an association, not proof that vitamin D directly improves sleep, they suggest that maintaining healthy vitamin D levels may be one piece of the puzzle for better rest. Many men also wonder about the connection between vitamin D and testosterone. Some research has observed that men with adequate vitamin D levels tend to have healthier testosterone levels than those who are deficient. However, clinical trials have produced mixed results. In other words, correcting a vitamin D deficiency may support overall health, but taking extra vitamin D does not necessarily increase testosterone in men whose levels are already normal. Vitamin D may also support the health of blood vessels. Blood vessels are lined with specialized cells called endothelial cells, which help regulate circulation and keep arteries functioning properly. Vitamin D receptors are present in these cells, and researchers are investigating how adequate vitamin D levels may contribute to healthy vascular function. This is an active area of research, and while promising, it should not be viewed as a guaranteed treatment for circulation problems. It's also important to know that more is not always better. Because vitamin D is fat-soluble, excessive supplementation over time can lead to harmful levels in the body. The safest approach is to have your vitamin D level checked by a healthcare provider if you suspect a deficiency, and follow personalized advice rather than taking very high doses on your own. So, while vitamin D isn't a miracle cure, maintaining healthy levels may support many systems that naturally become more vulnerable with age, including muscles, immunity, sleep, and blood vessel health. Blood flow and erection health. One of the biggest health concerns for many men over 50 is a gradual decline in blood flow. While this can affect overall energy and physical performance, it also plays an important role in erectile function. An erection depends on healthy circulation. When a man becomes sexually aroused, the brain sends signals that trigger the release of a molecule called nitric oxide. Nitric oxide relaxes the smooth muscles within the blood vessels of the penis, allowing them to widen. As more blood flows into the erectile tissue and is temporarily trapped there, an erection can occur.
As men age, this process may become less efficient. Blood vessels can lose some of their flexibility, and the inner lining of the arteries, known as the endothelium, may not work as effectively. This can reduce the body's ability to produce or respond to nitric oxide, making it harder for blood vessels to relax and deliver enough blood when needed. This is why experts often describe erectile dysfunction as more than just a sexual issue. It can sometimes be an early sign of cardiovascular disease. The blood vessels in the penis are smaller than those supplying the heart, so circulation problems may appear there before symptoms develop elsewhere. That doesn't mean every case of erectile dysfunction is caused by heart disease, but persistent symptoms should always be discussed with a healthcare professional. Where does vitamin D fit into this picture? Researchers have found that vitamin D receptors exist in the cells lining blood vessels, and deficiency has been associated in some studies with poorer endothelial function. Scientists are investigating whether correcting a deficiency may help support healthy blood vessel function. However, the evidence is still evolving, and vitamin D should not be considered a standalone treatment for erectile dysfunction. Healthy blood flow depends on much more than a single nutrient. Regular aerobic exercise, maintaining a healthy weight, controlling blood sugar and blood pressure, avoiding smoking, limiting alcohol, managing stress, and getting enough sleep all work together to protect the cardiovascular system. These same habits also support sexual health. If you're experiencing ongoing erectile problems, don't ignore them or rely solely on supplements. They may be a signal that it's time for a medical evaluation to check for underlying conditions, such as diabetes, high blood pressure, high cholesterol, or hormonal issues. Treating these conditions not only supports sexual function, but also protect long-term heart health. The encouraging news is that many factors affecting circulation are modifiable. With healthy lifestyle choices and appropriate medical care, many men can improve vascular health and maintain a better quality of life as they age. Coming up next, we'll explore how vitamin D may relate to energy, fatigue, and why so many adults over 50 feel drained even after a full night's sleep.
Why better sleep improves men's health? Sleep is much more than simply closing your eyes for a few hours. While you're asleep, your body enters a carefully organized series of stages that help repair tissues, regulate hormones, strengthen the immune system, and restore both the brain and muscles. For men over 50, getting enough high-quality deep sleep becomes increasingly important because the body's natural repair processes gradually become less efficient with age. One of the most valuable stages of sleep is known as deep sleep, sometimes called slow-wave sleep. During this phase, your heart rate slows, breathing becomes steady, and your body focuses on physical recovery. Muscles repair microscopic damage from daily activity, energy stores are replenished, and the brain clears away metabolic waste products that build up during the day. Deep sleep is also closely linked to hormone regulation. A significant portion of a man's daily testosterone production occurs during sleep, particularly when sleep is consistent and uninterrupted. Studies have shown that chronic sleep deprivation can reduce testosterone levels and may contribute to lower energy, decreased libido, reduced motivation, and slower recovery. While aging naturally influences hormone levels, protecting your sleep is one of the healthiest ways to support your body's normal hormonal balance. Another hormone released during deep sleep is growth hormone. Despite its name, growth hormone isn't just important for children. In adults, it helps maintain muscle tissue, supports metabolism, assists with tissue repair, and contributes to recovery after physical activity. As men age, natural growth hormone production gradually declines, making quality sleep even more valuable for maintaining strength and overall health. Many men over 50 notice that they wake up feeling tired even after spending 7 or 8 hours in bed. Often, the issue isn't the amount of sleep, it's the quality of sleep. Frequent awakenings, sleep apnea, stress, chronic pain, medications, or poor sleep habits can reduce the amount of restorative deep sleep the body receives. As a result, a person may wake up feeling unrefreshed despite spending enough time in bed. Researchers have also explored whether vitamin D deficiency is associated with poorer sleep quality.
Some observational studies suggest that individuals with low vitamin D levels are more likely to experience shorter sleep duration or disrupted sleep. However, current evidence does not prove that taking vitamin D supplements automatically improves sleep in everyone. If someone is deficient, correcting that deficiency may support overall health, but sleep is influenced by many factors working together. Simple habits can make a meaningful difference: maintaining a consistent bedtime, reducing screen exposure before sleep, limiting caffeine late in the day, exercising regularly, and discussing persistent sleep problems with a healthcare provider are all evidence-based ways to support better rest. Remember, better sleep isn't just about feeling less tired tomorrow morning. It's one of the strongest foundations for healthy aging, helping support energy, recovery, hormone balance, cardiovascular health, and overall well-being. What the scientific research says: whenever a supplement becomes popular online, it's important to ask one simple question: what does the scientific evidence actually say? Let's look at what respected medical institutions and research organizations have found about vitamin D, sleep, circulation, and men's health. The National Institutes of Health, NIH, recognizes vitamin D as an essential nutrient that plays a critical role in bone health, muscle function, and immune regulation. According to the NIH, vitamin D deficiency is relatively common, particularly among older adults, people with limited sun exposure, and individuals with certain medical conditions. However, the NIH also emphasizes that supplementation should be based on individual needs, rather than assuming everyone requires high doses. Researchers have spent years studying whether vitamin D influences sleep quality. Some observational studies have found that people with low vitamin D levels report poorer sleep, increased daytime fatigue, and shorter sleep duration. While these findings are interesting, they show an association, not a direct cause and effect relationship. Clinical trials have produced mixed results, meaning more high-quality research is needed before concluding that vitamin D supplements directly improve sleep for everyone. Experts at Harvard Medical School frequently emphasize that sleep, nutrition, exercise, and overall lifestyle work together to support healthy aging. Rather than relying on a single supplement, they encourage maintaining balanced nutrition, staying physically active, and addressing any underlying deficiencies identified through appropriate medical evaluation. Another area of active research involves blood pressure and cardiovascular health. Vitamin D receptors are found in blood vessel cells, leading scientists to investigate whether deficiency affects vascular function. Some studies suggest low vitamin D levels are associated with a higher risk of hypertension and cardiovascular disease. However, large clinical trials have generally found that vitamin D supplementation alone does not consistently lower blood pressure in otherwise healthy adults. This highlights an important point: association does not necessarily mean treatment. The Mayo Clinic advises that vitamin D is essential for overall health, but should not be viewed as a cure for complex conditions such as fatigue, heart disease, or erectile dysfunction. Instead, maintaining adequate vitamin D levels is considered one part of a broader healthy lifestyle that includes regular physical activity, nutritious eating, weight management, and routine medical care. Researchers have also explored the connection between vitamin D and erectile dysfunction. Some studies have observed that men with erectile dysfunction are more likely to have low vitamin D levels than men without ED. Because vitamin D may influence endothelial function, the health of the cells lining blood vessels, scientists are investigating whether deficiency contributes to reduced circulation. However, current evidence does not prove that taking vitamin D supplements will treat erectile dysfunction. If ED persists, healthcare professionals recommend evaluating common underlying causes, such as diabetes, high blood pressure, high cholesterol, obesity, smoking, medication side effects, or hormonal disorders. The Cleveland Clinic also emphasizes that erectile dysfunction is often linked to overall cardiovascular health. Since the blood vessels supplying the penis are smaller than those supplying the heart, circulation problems may appear there first. For this reason, persistent erectile difficulty should be viewed as a reason to seek medical evaluation, rather than simply trying over-the-counter supplements. So, what is the bottom line? Current scientific evidence supports maintaining healthy vitamin D levels because they are important for normal body function. If you're deficient, correcting that deficiency may support bone health, muscle function, immune health, and overall well-being. However, no major medical organization recommends vitamin D as a guaranteed treatment for erectile dysfunction, low testosterone, or poor sleep. The strongest approach remains combining healthy nutrition, regular exercise, quality sleep, weight management, and personalized medical care. That's the strategy supported by the best available evidence, and it's the one most likely to help you stay healthy and active well beyond the age of 50.
Best natural food sources of vitamin D. Now that we've looked at what the science says, the next question is simple. Where can you naturally get vitamin D? While supplements can be helpful for people with a confirmed deficiency, nutrition experts generally recommend getting as many nutrients as possible from a balanced diet whenever practical. Unfortunately, vitamin D is naturally found in only a limited number of foods, which is one reason deficiency is so common around the world. Let's look at some of the best natural sources. 1. Salmon, one of nature's best sources. Salmon is widely considered one of the richest natural sources of vitamin D. A single serving can provide a substantial amount of your daily needs, although the exact amount varies depending on whether it's wild-caught or farm-raised.
Beyond vitamin D, salmon is also packed with omega-3 fatty acids, high-quality protein, vitamin B12, and selenium. These nutrients support heart health, brain function, and healthy aging. Eating fatty fish once or twice a week is often recommended as part of a heart-healthy eating pattern. 2. Sardines. Small fish, big nutrition. Sardines may be small, but they're incredibly nutrient-dense. They provide vitamin D, calcium, omega-3 fats, and protein in one convenient food. Because sardines are typically eaten with their soft edible bones, they also help support bone health, an important benefit as men get older. 3. Egg yolks. Eggs remain one of the most affordable and versatile foods available. While the egg white is an excellent source of protein, the vitamin D is found mainly in the yolk. Eggs also provide choline, selenium, and several B vitamins that support normal metabolism and brain health. Enjoying whole eggs as part of a balanced diet can contribute to your overall nutrient intake. 4. Fortified milk and dairy products. Many types of milk are fortified with vitamin D, meaning the vitamin is added during processing to help people meet their daily needs. Some yogurts and plant-based beverages, such as fortified soy or almond milk, may also contain added vitamin D. Always check the nutrition label because fortification levels vary by product and country. 5. Mushrooms. Unlike most vegetables, certain mushrooms can naturally produce vitamin D when exposed to UV light, much like human skin produces vitamin D from sunlight. UV-exposed mushrooms can be a useful option for people who eat little or no fish, although the vitamin D content varies depending on how they were grown. 6. Tuna. Tuna is another seafood that contributes vitamin D, along with lean protein and important minerals. Whether fresh or canned, tuna can be part of a healthy eating pattern, though it's generally recommended to choose lower mercury varieties and enjoy it in moderation. Don't forget sunlight. Food isn't the only source of vitamin D. Your skin naturally produces vitamin D when exposed to sunlight. However, age, season, sunscreen use, skin tone, clothing, and time spent indoors can all influence how much vitamin D your body makes. For many adults over 50, especially those who spend most of the day indoors, food and sunlight alone may not always be enough. That's why some people benefit from testing and, if necessary, supplementation under medical guidance. The goal isn't to rely on one superfood. Instead, focus on a balanced eating pattern that includes a variety of nutrient-rich foods to support your overall health. How to take vitamin D correctly. If your healthcare provider recommends a vitamin D supplement, taking it the right way can help your body absorb it more effectively. Take it with healthy fats. Vitamin D is a fat-soluble vitamin, which means it dissolves in fat rather than water. Research suggests that taking vitamin D with a meal containing healthy fats may improve absorption. Healthy fat sources include foods such as avocados, nuts, seeds, olive oil, salmon, eggs. Simply swallowing a vitamin D capsule on an empty stomach may not be the most effective approach for some people. Morning or night, which is better? Many people wonder whether vitamin D should be taken in the morning or before bed. The truth is that there's no strong scientific evidence showing that nighttime is universally better than morning for everyone. The most important factor is taking it consistently. Some people prefer taking it with breakfast because it's easier to remember, while others take it with dinner if that's their largest meal. If you notice that taking it late in the evening seems to affect your sleep, discuss this with your healthcare provider and consider taking it earlier in the day. Consistency matters more than timing. Vitamin D doesn't work like caffeine, where you feel immediate effects. It takes time for vitamin D levels in the body to change. That's why regular daily use, when recommended by your healthcare provider, is generally more important than the exact hour you take it. Know your vitamin D level. Before taking high-dose vitamin D supplements, it's often helpful to know whether you're actually deficient. A simple blood test called 25-hydroxyvitamin D, sometimes written as 25-OHD, can help your healthcare provider determine your vitamin D status and recommend an appropriate dosage if needed. Testing is especially valuable for older adults, people with osteoporosis, individuals who get very little sunlight, or those with certain medical conditions that affect nutrient absorption. Avoid taking more than you need. One of the biggest mistakes people make is assuming that if a little vitamin D is good, then a lot must be even better. That's not true. Because vitamin D is stored in body fat, taking extremely high doses over long periods without medical supervision can lead to vitamin D toxicity, a rare but serious condition that can cause high calcium levels, kidney problems, nausea, confusion, and other complications. Always follow the dosage recommended by your healthcare provider or the product label, and avoid megadoses unless they have been specifically prescribed for a confirmed deficiency.
Remember, supplements are designed to support a healthy lifestyle, not replace balanced nutrition, regular exercise, quality sleep, and routine medical care. Together, these habits provide the strongest foundation for healthy aging and long-term well-being.